And welcome back to This and That. We're now joined by Janet Kramer-Mai, who's a registered nurse at Erlanger Center for Breast Health and also a manager there and a breast cancer navigator. Did I leave out anything?
I think you got it.
All right.
Good job.
Breast cancer navigation, what is that?
Well, a navigator in a breast center does just that. When a patient comes in, if there's first of all, nobody wants to come to the breast center and have a mammogram to begin with. Anxiety levels are high. But if something abnormal is found on a mammogram, a navigator is introduced into the process earlier. We act as the educator, the go-to person to get questions answered. Some women immediately have financial concerns, so we roll into a social worker mode. So we're the person that's going to navigate the patient from point of abnormal mammogram until whatever point that stops. If it's an abnormal mammogram, and we simply get them set up with the surgeon, we're going to do their teaching on what to expect when they see the surgeon. Here's what to expect when you have a biopsy. Here's what to expect after your biopsy. If the biopsy comes back, a benign finding, we're still available to them as they have needs, but at that point, they're done with us. If the biopsy is positive and it's a cancer, our role continues and we continue to educate them. We help them out with what to expect during surgery, educate on what their surgical options are after they see their surgeon, and we continue to be part of their journey from there.
And I think probably one of the biggest things that would help out is sort of the emotional side of things. True. Because, yes, the doctors, the nurses are sort of going to explain a process or findings, but the social side of it or the emotional side of it, that's going to be some pretty big benefits too.
Yeah, and they get all their initial findings from their surgeon, from their medical oncologist, from their team, and then we're a backup to that. Because you walk away from those appointments and you hear about 2 minutes of the 20 minutes that you got. So we're the backup to reinforce what they have found, what they've been told, what they have found, and where they're going from there. But yeah, the peer support, I actually happen to be a breast cancer survivor. So the surgeons introduced me as somebody who, I have dual roles. I can handle the medical side of it with the medical questions, but I'm also the person who's been there, done that, and can be that person who helps them through their journey based on where my journey has taken me.
Now, oftentimes we talk about maybe the process or celebrating afterwards, but there are times when you just don't want to go, but there are some guidelines that you guys have, suggestions that you guys have as well. What are some of those guidelines, and when should women really start going and just getting maybe their first mammogram?
Well, most insurance companies pay for your first mammogram between the age of 35 and 40, and we call that baseline, just meaning your initial one. Most insurance companies continue to pay for them annually after the age of 40. If you have a family history, let's say your mom was diagnosed with breast cancer at 38, guidelines say that 10 years prior to the onset of her cancer is when women should have discussion with their primary care doctor, their gynecologist, as to what is appropriate for them. Should they begin ultrasound? Should they do screening mammograms? How should they be followed? And
guys, I mean, there's something, the guys are most stubborn here, but
I think you referred to them as dudes earlier. So dudes got
to get checked too.
Yes, and unfortunately, most of the time when we see men coming into the breast center, it's because they've already they already have a palpable lump. It's something they have felt. But when a dude or a male enters the breast center, they're treated exactly like the women are. They receive a diagnostic mammogram and ultrasound, and they follow the same flow that a woman's path would.
Well, we certainly do appreciate everything that Erlanger does in supporting women's health and dudes' health too. It is Erlanger Medical Center. You can contact them by going to the website erlanger.org/east in this case, or you can call the phone number of 423-778-PINK. Again, 778-PINK for more information about the great programs that they have and also the great navigators that they have as well. Appreciate you coming on the show.
Thank you very much.
All right, thank you. All right, folks, coming up next.